Hi, this is Stu, and today we're going to look in our little series on injuries or potential injuries that occur during the yoga practice at SI joint problem. And you know, this can sort of creep up on you and it can be very serious. You know, you'd think that being a yoga practitioner for many years and anatomy idiot, that I would actually have more sense. But I've also hurt my SI joint. So it can happen to you whether you think you know what you're talking about or whether you don't. So basically, where you're going to feel that pain, you're going to feel it round about here. So if you could follow your iliac crest around, and we're going to put a picture up on the screen so as you can see this, and you have the sacrum coming in at this angle here, obviously the same on both sides, coming across and creating that sort of triangle here. And so SI means sacroiliac joint. So that's what we talk about, the SI joint. And the pain is sort of here. Now, it can be what I call a grumbling pain. So it can be just a nagging, sort of achy sort of feel. Or it could be quite sharp that you feel at certain times, yeah? Or, like I had, it could be so bad that actually you can't stand up and you need to lay down for a month and then you need crutches to walk around on for another few months, yeah? So it can go from that grumbly feeling to something really pretty nasty if you're not careful, yeah? So what is the problem? The problem is that the SI joint is ligamented, yeah? It's only supported by ligaments. There's no muscles whose job it is to support that joint, yeah? So if you strain those ligaments, yeah, or actually I should be sprain because the ligament, sprain those ligaments, then, or one of them even, then it's very difficult to create that stability again. So that's the first issue. And you're going to have that sort of nasty pain that you get from ligament pain, or you can even inflame that whole joint, yeah? So let's think about the mechanisms by how it happens and then what to do once you've got it, or if you've got it, yeah? So really it's to do with the fact of torquing, so that means twisting or unevenly moving the sacrum within the iliums, yeah? And so we have to think about the ways that we can possibly do that in yoga. And a lot of people that come to me with SI joint issues or going on is sometimes around that same sort of period where they've started to work towards putting their foot behind their head, yeah? And so why would that be? The reason for that is to put your foot behind your head, yeah, which is at the first third or so of the second series in Ashtanga, you need a lot of external rotation in the hip, yeah? You need a lot of external rotation in the hip. Obviously you need long hamstrings as well, but the more external rotation you've got, the easier it is to going to be able to take it behind there. Now, let's say you don't have that much external rotation in the hip, but you're still going to want to have it behind your head. So what can happen? You take up the amount of external rotation you've got in the hip, and then you start going and you keep going, yeah? But what happens is you start taking that half of the pelvis with you, yeah? And if you can imagine then, the sacrum is attached to your spine, it's still coming down, but you're moving this, you're using your leg as a lever to move this side of your pelvis, yeah? So you're torquing the pelvis relative to a relatively stable sacrum, yeah? So this is how the mechanism of how the injury can occur for many people. Now, again, it isn't a rite of passage, yeah? You don't need to be suffering with this pain and get through it in order to be then at some stage comfortable with your feet behind your head. If you're torquing your sacrum, you're torquing your pelvis relative to your sacrum, you're creating SI joint pain, you're going to make your SI joint unstable, and you're going to feel that later on, maybe several years down the line, where it just doesn't feel quite as it wants to be, and you're going to have trouble stabilizing it. So again, if you're feeling that sort of pain, don't do it, yeah? What you need to do is go back to the basics and say, why am I feeling that pain? I'm feeling that pain because I'm trying to do a posture I'm not yet ready for, yeah? So in that case, you've got to work on the external rotation of the hips. So again, look at our little video, supplementary video on hip opening. and you're going to have to work on the hamstrings, and you're going to get a teacher to look at you while you do it. Yeah. One of my caveats for doing foot behind head is to sit back against a wall. Yeah. Put one leg out straight, and then take this hip into external rotation and bring it up, holding underneath the ankle so that you're not straining the ankle, and bring your foot up and see with your foot or with your back and your head against the wall, the back of your head against the wall, can you bring your foot to your head? Yeah. If you can't, then all that difference between where your foot is and where your head is, you're going to make up with dipping underneath or torquing the pelvis. So you're either going to hurt your low back or you're going to hurt your SI joint. Yeah. The other thing is any asymmetric postures have the same sort of ability, but maybe not as dramatic as the foot behind head postures. Yeah. So postures like Warrior One is another one that can aggravate the SI joint, particularly if you're a beginner and you're not particularly open in the hips. Yeah. Because of the fact we've got one hip back a little bit, we've got our hip externally rotated. Yeah. Planted on the floor, we've got some grounding, and then from that position we're told bring your chest to the front to then lift up, and so we've got this hip and we're trying to get some movement here, so again we can be torquing that sacrum within the iliums. Yeah. So Warrior One is another big one. Yeah. So one of the easiest things, and this is also a remedy for if you're suffering also already with SI joint problems, and this is maybe what you should be doing, is take a wider stance with your Warrior One position. So by wider, I don't mean the length of the mat, I mean this way. Yeah. So the way you would do it would be, I would be in my down dog, okay, here, and instead of bringing my foot towards the center, instead I would bring my foot behind, or maybe just inside my front foot, and then when I'm coming up, I've got a much wider stance, and it allows me to actually square my hips more. Yeah. If I can square my hips anyway, even with my back foot down and a narrow grip, then I don't need to do that. But if I notice that there's that twisting of the hips, then take a wider stance. It's much, much nicer. And the other thing you can do is come out onto the ball of your back foot. So again, that has the same thing, the same effect of squaring up the hips. So again, instead of here with my back foot, I'd be there with my back foot as I then came up. And then you want to be strong with your back leg and straighten your knees, and we'd be going up into Warrior One. Yeah? I'm staying down there so I don't disappear off the top of the camera. So you want to be thinking about how can I create less torquing around there. The other big one, of course, is Parivrtta Konasana. Yeah, with that back foot again turned out and grounded. So what you want to do in that particular posture, particularly if you're bringing so it's the twisting that's going on here, this hip is being pulled back, and here now I'm adding a twist to it, and now I'm going to put my hand down here, add even more torquing. Make it easy on yourself. Take that back heel off the floor and square up the hips a bit more. Then you're going to be able to come down. Okay, it's not textbook, but it's a lot nicer on the hips, a lot nicer on the SI joint. So particularly again, if you're already suffering with SI joint problems, then that's the thing to do, is to make it a little bit easier. Okay, so we've talked a little bit about how we can hurt the SI joint. I'll also tell you now that not all pain that feels like it's SI joint is coming from the SI joint. Yeah, it can be. There's a muscle here, yeah, running between the bottom of the ribs, the spine, and the top of the pelvis, yeah, the iliac crest, called the quadratus lumborum, yeah, and tightness in trigger points in the quadratus lumborum can radiate pain down to the SI joint, yeah. The other thing that can happen is tightness in glute medius, glute minimus can radiate pain across to the SI joint. So don't panic if you're feeling pain around that area. Doesn't necessarily mean it is the SI joint, but sort of check these areas out too. If you're tight in the side bending positions, check out your quadratus lumborum. It could be that's tight. If you're tight in these external rotated positions, it could be glute medius, glute minimus tension there. So not everything pain there is actual SI joint problem. A lot of it is radiated pain. But if you start feeling also a little bit sort of not very stable there, then again, that's the time to start thinking about what else I need to do for that area. Well, it's about actually strengthening those muscles that run transversely across. So it's about strengthening transverse abdominis and strengthening some of the hip muscles that actually can create a little bit of stability around that area. Because of course I told you already that it's actually no muscle whose job it is to stabilize that area. So it's like stabilizing secondary effects, yeah? If we're thinking about now, we thought about what it is, how we've hurt it, we can also think about now the rehab and the sorts of postures it likes. So with SI joint issues, doesn't really like too much asymmetrical postures. So even things like Janu Shirshasana, that's asymmetrical, this hip is opened up, I'm twisting here, the stability between one and the hip and the other will be different. So it won't necessarily like it, but depending on your journey down that route, it might not be an issue. But if it's severe pain, then you're not going to be wanting to do anything even like that. But it will like generally symmetrical postures. So not so bad with Baddha Konasanas, not so bad with Upavishta Konasana, everything that is symmetrical both sides. Prasarita Padottanasana, the standing version of Upavishta Konasana. So those sorts of postures are generally quite good for it because it likes that sort of feeling, yeah? It likes the evenness, the symmetry. The other thing you need to be careful of with SI joints, I mean, I thought I was finished and then something else popped into my head. Basically, it's attached to the pelvis, okay? The sacrum is attached to the spine, yeah? And then into the pelvis. So anything where we are rounding too much, yeah, and levering. So if I'm curving my back, I've got hold of my feet, and now I'm pulling to bring myself forwards, then the chances are that those forces in the spine will either congregate around the low back, which is an issue in itself, or we can be then torquing the sacrum again, yeah? So always be careful of your forward folding. And there's one in particular that if you've watched our video on Utthita Hasta Padangusthasana in Asana School, I will have mentioned it there. And that's coming forwards with us over that straight leg in Upavishta Konasana, okay? So Upavishta Konasana, did I say that? I meant to say with Utthita Hasta Padangusthasana, yeah? So if you're standing, you're doing Utthita Hasta Padangusthasana, but your hamstrings only let you come to parallel with the ground. So my leg is here, yeah? I'm holding on to it, and then I'm thinking about folding forwards. Again, that is something that can really strain the low back and the SI joints because of the fact that we've got all our weight out in front of you, yeah? And it's totally different to the fact that if your leg is up here and then you're just coming to meet it. That is not the same as when your leg is down there, only parallel with the ground. So for me, I would say don't come forward unless your leg is like really high. If you've got the assistance of a teacher, then that's different because they're taking the weight of your leg, yeah? But if all the weight is out there and then you're going to try and come forwards, you're asking for trouble, yeah? So these are all the sorts of ways that you can try and prevent this sort of SI joint issues from happening, yeah? So always think about where am I moving from? Am I putting pressure into this area? And just try and be compassionate with that part of your body, and hopefully you'll stay out of trouble. Hope that helped, and we'll see you next time. So again, we're moving up the body, so we're going to think about low back and QLs and that sort of stuff. See you soon.